Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hi, everyone. This is Ming Gray. I am a facial plastic and reconstructive surgeon at Mount Sinai in New York, and I'm joined with Brittany Barber.
Hi there, guys. Brittany Barber here from University of Washington, head and neck surgeon.
And we are here to talk about our manuscript, Feasibility of Labia Myocutaneous Free Flap, a study of a novel mucosal free tissue transfer. I'm very excited to be here because this is something that Brittany and I worked on several lifetimes ago. I guess, Brittany, do you want to tell us a little bit about how this project began?
Yeah, so I was a fellow doing the Mount Sinai Head and Neck Reconstruction Fellowship, and Ming was an R3 at the time, and she approached me with this idea, all kind of thought out by her, and I was free on the weekends and after our flaps ended. So we decided to get together. She had done a lot of background work to access some anatomic cadavers through the med school with Dr. Laitman. And we researched kind of the anatomy around the flap and just dove in. And we're able to find that this can be a very successful option for mucocutaneous reconstruction.
Yeah, and I guess for the readers out there, many people have wondered where this idea came from. As Brittany mentioned, I was just a junior resident reading up on a case, and the next day I think we had a very large lip defect, and everyone knows that it's can be quite challenging to find the proper reconstructive option. And so, it was one of those situations where the stars aligned, and we had great support from our mentors and our institution to do this study. But you can imagine how hilarious in retrospect it was to approach our faculty about with this idea. But Brittany was such a champ in supporting it. I have the text messages from now many, many years ago when I proposed this, and she was like, I can't tell if you're joking or serious. Um, but we did it. We spent a lot of creepy hours in the dead of night in the anatomy lab to prove the feasibility of this. And of course, the pedicle of the flap is an internal pudendal artery. And in speaking with our general plastics and GYN colleagues, this is not a entirely wild idea. They use the tissue in this area quite often for pelvic reconstruction, but it's just never been described as a free flap. So yeah, I think there are a lot of opportunities for this new free flop. Brittany, do you want to discuss some possibilities besides maybe the obvious, which is a lip defect?
Yeah, so I mean, clearly there are a couple different both mucosal and mucocutaneous defects that we don't have good reconstructive options for. One that comes to mind, other than obviously the lip, is the eyelid. So that might sound a bit unorthodox to some, but the lower eyelid, after, say, for example, maxillectomy with titanium mesh and radiation, is not uncommonly affected by that and the titanium mesh can become exposed. And often, if we are unable to salvage the wound, we end up having to cover it with a forearm, which is quite a bit of tissue to put into that area. It's also kind of bulky. The skin is thicker in a lot of patients, and so that was another option where something with thinner mucosa, thinner skin, which is obviously the case here, is both reasonable for reconstruction, but also for, pedicle length and for the amount of tissue that you need in that area. So that was another option. That was brought to us by one of the authors on the paper, and you can see that in a couple of the pictures that we took in the anatomy lab.
Definitely. And then obviously there are challenges and shortcomings for related to this flap. The pedicle is on the shorter end, and obviously this flap is only feasible for female patients. But I think if nothing else, this project showed me that you can be very early in your career, still be in training, even like the two of us were, and have a new vision for how things have always been done. And so it's that, and I do have to commend our mentors and co-authors for having a sense of possibility and this tremendous support for us, now that we're on the other side, to to do this project. And I think that in retrospect was the most fun and exciting part of all of it.
I would just add that often it is surgical trainees that have a more open mind than us who have been in practice for a while. And so many surgical innovations in our field, in particular in head and neck surgical oncology, have come from trainees rather than people at the attending level. And so in addition, often trainees are a little bit closer to some of those other surgical specialties. In this case, plastic surgery rotations, gynecologic reconstruction, general surgery. So they've seen things that can be adapted to our specialty. And indeed, this flap has been used in other ways, just not in the head and neck before. So certainly, if you have ideas and you're a trainee and you can see they can be adapted to our field, speak up, and you too can come up with a novel surgical idea.
Yeah, so don't be afraid to speak up and don't be afraid to branch out. Thank you so much, Brittany, for joining me for this podcast. And I hope everyone will subscribe and read more in FPCM.
Thanks, guys.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.